Welcome, dear friends, to Homeomitra Vartaalap. This time we have our guest, Dr. Shraddha Joshi, who is a practicing homeopath. She's practicing in Dombivli since the past 3 years. And along with her private practice, she is also associated with the Rotary Club, where she provides homeopathic consultation on charitable basis. She has done her BHMS from Yerla Medical Trust, Homeopathic Medical College, and her post-graduation in the subject of Repertory from Dr. M.L. Dhavle Memorial Homeopathic Institute. Welcome, Dr. Shraddha, to Homeomitra Vartaalap. Today's topic of discussion is going to be using different type of remedy for treatment of cough in homeopathic practice, and what Dr. Shraddha has experienced so far, and she will share her experience with us. And there is definitely going to be a lot to learn for homeopaths, because cold, cough, fever is a kind of a bread and butter for the homeopath. Trust me, scenario is changing nowadays. Good old days, it used to be that the patient would go to the general practitioner who would be an MBBS for allopathic medicine, but हमने अभी देखा है कि patients homeopathic doctor के पास आते हैं. Even the regular patients जो दवा लेते हैं, and even there are walk-ins who come and inquire about, if this fever, cold, cough can be treated with homeopathy. So, Dr. Shraddha, before we start the podcast, please tell us something about yourself so that the audience will be able to relate to the podcast better.
Okay. About myself is that as you have introduced myself in a better way. So about my graduation, post graduation, everything. I want to add that how I developed interest in homeopathy, or so many patients, my family members and relatives ask me how you chose homeopathy, or what are the things that made you choose this profession. So actually, right from this credit I want to give to my parents. Actually, right from my childhood, my parents did not give me actually any kind of antibiotics, cough syrups, nothing sort of that. But right from I was 6 months of age, they used to take me to a homeopath in Dombivli, Dr. Seema, and later on I started my treatment with Dr. Palod in Dombivli only. So I used to see them how they prescribe, how they take history. वो बहुत इंटरेस्टिंग लगता था मुझे उस वक्त. सो आई स्टार्टेड डेवलपिंग इंटरेस्ट इन होम्योपैथी and wanted to learn more and more about homeopathy, and that was my first choice of medical admission actually. Many of students of homeopathy nowadays have this story that मिल गया इसलिए होम्योपैथी में आए, but no, my first choice was homeopathy, and so that I started in that way. My journey started in homeopathy. Yes.
Great. So, Dr. Shraddha, very interesting. And I would say, when as a child, the child, जो बच्चा जो है ना वो होम्योपैथिक दवा लेता है ना, तो it is always better in terms of long term immunity is always good. This is what I have observed and noticed this personally in my practice. And I want all of you who are listening to comment if you have also as a child taken homeopathic medicines, and more so if you have now entered into homeopathy, either studying homeopathy or now practicing homeopathy. So, Dr. Shraddha, what are the common type of respiratory illnesses that you see in your daily practice, and in which particular age group you find them more common?
Okay. Actually, nowadays, as you have rightly said, respiratory symptoms, respiratory complaints in general are actually bread and butter for a doctor or for a homeopath maybe to start with their practice, because normal flu, cough, cold, all those symptoms come to us on a daily basis. Right from if we see in a 1 week analysis, there are so many cases. Actually, 50% of cases we get of respiratory complaints nowadays, because of our changing lifestyles, pollution, environmental factors. Common viral infections are also increasing nowadays. In if we see school going children, or teenagers, or children who are going to play groups, babysittings, etc., they are in their age group, common viral infections are increasing a lot due to the close contact with the other child who has the same complaints. Allergies are also increasing nowadays. Like I have seen so many cases of allergic rhinitis, sinusitis, allergic bronchitis, asthma, and so on. So these complaints are also increasing a lot nowadays. Not only environmental factors are responsible, but also our lifestyle is also responsible for this. Tobacco, cigarette smoking, all these factors play a very vital role in causing all those conditions. people who are chronic chain smokers, cigarette smokers, tobacco chewing habits, asthma, bronchitis, all those complaints are very much we can see in these patients. Also, genetic factors play a very important role in these cases. Say, for example, bronchial asthma, tuberculosis, all these respiratory complaints, even allergic rhinitis has a strong family history. If your parents, even grandparents has such complaints, next generation gets these complaints. Also, stress is a major factor, I feel, not only in adults and agedly people, but nowadays children are also getting all those symptoms because of stress. कुछ पूछते हम लोग तो मम्मी बोलती है पढ़ाई का स्ट्रेस है, कंपटीशन है, इसलिए ये बढ़ जाता है. I mean, I wonder so much, but yes, in children also, because of stress, all these complaints are increasing a lot. Along with that, tonsillitis, nasal polyps, pharyngitis, upper respiratory infections are also very common in teenagers and children. Tuberculosis, family history of tuberculosis, all these points are also important. So there is a wide range of respiratory complaints actually, which we see on a daily basis. In my practice, I have personally seen in these 4 to 5 months that this one thing is very common, that is elements from change of weather, or this because of this changing continuously changing weather. This only be on the basis of this rubric, say, or on the basis of this point I have prescribed so many remedies. Like, this point is very much important, or there is a history of travel, this point is also I have seen in many cases. So these are the common things, respiratory complaints are seen on a daily basis. So the role of homeopathy comes into picture, where we can see characteristic symptoms, modalities, and all those points which we can discuss later on. So all these complaints I'm seeing on a daily basis.
Quite interesting. I mean, we are not just looking at infective cause of illnesses, but allergies. And then now, more so, like you said, what you're emphasizing on is stress as a cause of illness. Uh, so, yeah, quite interesting. So, dear homeopaths who are watching right now, please comment in the comment section below what kind of causations you are seeing in children with which you often come across with respiratory illnesses. So, Dr. Shraddha, my next question would be, what are the essentials that a homeopath should be aware of before treating respiratory complaints in their OPD practice?
So in this question, I would like to discuss about which cases we can treat in on a daily basis in OPD in clinic, or which we should not take and immediately say refer. This is a very important aspect and crucial aspect. We should be very much cautious while seeing such patients, because as it is the matter of patient's life. Not only case taking is important at such at these places, but also very close and keen observation of our patient, plus on examination findings play a very crucial role. If patient comes to you or comes in our clinic with severe respiratory distress or any other complaints, we have to refer. At that time, we cannot wait. On the other hand, if patient is in dyspnea, constant mucus production or sputum production, history of fever, on auscultation there are bronchi or crepes, say whatever it is. But you can very well treat those cases in OPD also, provided his patient's complaints are not worsening day by day. For this, you need to keep frequent follow-ups with your patient, say daily or at least every 2 days, so that you can assess. If you feel that patient is getting better, you can definitely treat him or her with homeopathy. But if you find that your patient is getting worse, or your symptoms are getting worse, on examination findings Roncar crepes are getting increasing, or there is reduced or no air entry on either places, or if pattern of respiration, use of accessory muscles, you should check for all those conditions. At some point you can take the use take the help of laboratory test or x-rays, ct scans, whatever. Sometimes patient comes to you with x-rays already done. So if it says some severe conditions like pneumothorax, severe pleural effusions, or CT scan showing moderate to severe pleural effusion, you have to refer and change the line of treatment at that point. Sometimes patient comes to you with direct some advanced reports, culture reports, blood cultures, sputum cultures. If it is showing some growth of organism, but colonization is less, and the symptoms are also getting better by your treatment, you can treat with homeopathy. I'm not saying if culture report is saying showing some bacteria, you cannot treat homeopathically. You can treat very well. But if it is culture report is showing bacteria and increased colonization, say for more than 1 lakh, and symptoms are also increasing, constant fever spike in spite of giving continuous antipyretics, other homeopathic medications, increase hemoptysis, or other complaints are worsening, you have to change your line of treatment and advise hospitalization if needed. So yes, this point is very important that you have to decide what to take in on OPD basis and what not. There is always fear that if you refer or advise hospital admission, people feel that you will lose your patient. No, this is not always necessarily you will lose your patient. You can side by side, of course, you can continue your homeopathic medication, or you can just stop your treatment for time being and then restart. But the decision which you take at that time for your patient, that plays a very crucial role for relatives and patient. That patient will remember for a life, and definitely if you have taken a good decision for him or her, they will definitely come back to you.
Agreed. Wow. I'll tell you, this was reminded me of my first year Hutchison's textbook
Ah,
of clinical medicine examination, and the final year textbook API and Harrison in medicine. Both that first and fourth year correlation, and very refreshing actually, that when you know your basics, and when you, especially with the vital parameters and the lab reports in a progressive manner, they are deteriorating, is the time when patient has to be referred. This is very critical. Okay, so Dr. Shraddha, we'll go on to the next question. Are there any techniques that you have been using in treating respiratory illnesses in your practice now that you have almost experience of 3 years and having seen so many patients?
yes. Actually, not any specific technique I have used, but as per it depends as per the case. Actually, I have seen many of the respiratory complaints which come to us. They are of very many years duration, and they have taken already some sorts of other treatments, and finally they come to us for the treatment that मैं थक गया हूँ, अब मुझे होम्योपैथी से ठीक होना है. ये वर्ड्स मतलब कॉमनली सुनने मिलते हैं. so if that there is no change in picture or no acute symptoms at that point, I usually go for a thorough case taking and start directly with constitutional or anti-miasmatic as needed by the case. If the picture is acute and patient is having severe cough or sneezing or is unable to talk and is in distress, at that time I just take acute picture in a complete picture, and then I prescribe on acute basis on for that time being. And after the 1 week when the patient returns, at that time I complete my case taking. That way also I have done. In some cases, only anti-miasmatics also play a very good role. So only depending on PQRS symptoms or keynote symptoms also I have prescribed in many cases. In few cases I have seen patients say that गले में और छाती में तकलीफ है, यहाँ 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 उतना ही दिखा रहा है. So throat and chest affection, on that basis I have given phosphorus 30 also in lower potencies basically. So ऐसे भी कुछ प्रिस्क्रिप्शन थे जिसने वंडर्स दिखाए. So accordingly as per the case I have given.
Interesting. Huh? Now we are entering into the academic arena of treatment of respiratory illnesses, and I'm sure homeopathic doctors watching this right now are going to watch this most in the entire episode. Do share with us in the comments what kind of protocols you have developed in your practice for treating respiratory illnesses, and what kind of references you take, and also that so far if you have found the information useful. Stay with us. We are going to come to a very interesting part at the end of the episode. So, Dr. Shraddha, any common rubrics or remedies that you have found useful in treating respiratory illnesses in your practice? Like you just mentioned about the throat and chest complaints.
Yes.
You use phosphorus in lower potencies. Any other such?
as I said earlier, there in these few months I have strongly seen actually weather change, history of weather change or travel history, and for that thing I have used dulcamera and jalsemium in lower to medium potencies, and dulcamera in medium potencies has always given me a very good results actually. So dulcamera is, you can say, my favorite. That has become my favorite remedy. Jalsemium has given very good results. In few cases, patient is just having some common symptoms like just there is sneezing and better by warm application, throat pain, better by warm drinks. In such cases, hepar sulfin medium potency also has helped a lot actually. I still remember one case of mine. She was suffering from viral bronchiolitis. So actually, in viral bronchiolitis, fever is there for 1 to 1.5 week, and cough and sputum production is going to be there for 2 to 3 weeks. So she also had same complaints. Somehow I managed to subside her fever spikes with homeopathy, and if needed, Dolo 650 was advised, but majority homeopathy. But after some time, but cough, I was unable to treat her cough. I tried all. Also, she was having dyspnea, rhonchi bilaterally. I tried many sorts of medications like antimtat, arsenic album, rustox, and stannum mate, and everything I tried, but nothing was nothing. No medicine was showing any good results. Till that time, I had not used Rumex in my practice, but after I re-repertorized her case, it was showing Rumex in the repertorization sheet. So I thought of, I read about Rumex. So it is a very oversensitive patient and very much sensitive to cold, any form of cold, cold air, cold drinks. कुछ ठंडा खा लिया तो तुरंत कुछ हो जाता है उसको. Because of laryngeal affections, there was hoarseness. She was also having the same complaint. Plus there is sputum production. Plus there is throat irritation starting from throat, tickling in the throat till down the chest. So I repertorized. Rumix came. It was matching with exactly patient picture. So I prescribed Rumix in medium potency, and it created wonders actually for that patient. She said after 3 days, 3 doses only. So after 3 days, she came for follow up, and she said कि डॉक्टर जब से आपने वो दवा बदल के दिया तब से मैं अच्छी नींद ले रही हूँ. And I was like, yes, Rumex is very good. And since that time, I started using Rumex frequently in my practice in medium potencies. In that case, Spongia and Rumex are very close in the sensation, tickling sensation, because in Rumex also there is tickling like a feather, but in Spongia there is tickling in throat only limited to throat area, and there is dry cough majorly. But in Rumex it goes down till your chest. So other remedies also I have used like Sabadila, Allium Sipar, also my favorite remedies for allergic rhinitis. So there are so many actually wide range of variety rubrics and remedies which I have used in my practice till now. I have seen one case of bronchial asthma where my patient had um, very very sad episode of about her daughter, and there was a very acute grief in her life. So I studied one rubric in complete repertory, asthma after grief, and the remedy was natrum sulf. So I prescribed natrum sulf in lower potency, and it gave me a very satisfied results. So natrum sulf is also very good remedy for asthma after grief. So that was also a very interesting case. So accordingly there are so many.
Quite interesting experiences and remedy, materia medica sharing as well as rubrics that you have shared. Now, this gets me curious that you also have a good hold of materia medica and repertory in this subject. Obviously, your master's is in repertory. So I'm sure we can take up one of those topics of remedy differentiation and rubrics finding in repertory in any of our future podcasts. So, dear audience, do write in the comment section what would you like to hear from Dr. Shraddha on this particular topic, and we will try our level best to take it up in the next podcast. Right. So, as we are ending and coming towards the end of our podcast, Dr. Shraddha, tell us something that kept you from not taking up respiratory illness cases, especially failures? And what kind of message you want to give across to the homeopathic doctors who find it very difficult and at times disheartening when you do not get results in respiratory illnesses? And I'm sure all of us have plenty of cases where we have faced failures. So, what message would you like to give to the doctors?
Actually, I feel all of us in our initial days have gone through this feeling that results ही नहीं आ रहे. So what is to be done? Should I leave the case? Should I refer? Should I stop? Or all those feelings come in my even in my initial days. I still remember there were few cases where I did not even when I was unable to treat simple allergic rhinitis or viral infections in spite of giving so many remedies, changing so many potencies, but and finally I lost my patients. This has also happened, but we learn from those cases actually. I feel when we lose some patient or when we are not able to treat any case, we study more and more about that topic, we study more and more about that case. So yes, keep studying every case, every patient. And in respiratory complaints, I feel it is very important to get a complete picture or complete symptom of the patient, because in homeopathy sensation plus your modalities are also very important. Because in common modalities like for allergic rhinitis, if patient says aggravation from dust, aggravation from strong smell, these are not important. I feel these are not very important for because these are the common symptoms of that case, of that disease. But in spite we can ask him or her for any time modalities or any concomitant symptoms. Concomitants play a very crucial role in respiratory or even generally in homeopathy, I feel. So try and get the complete picture, complete symptom of that patient, any specific craving, sleep patterns, how his or her mood is. Especially in pediatric cases, this concomitant part plays a very crucial role, I feel. Is child active or dull during the episode, crankiness, restlessness, all those points we have to ask. And it is always, I have seen some in some cases, in at some places, इट इज सेड दैट होम्योपैथ्स को क्या जरूरत है पेशेंट को चेक करने की, या पेशेंट से आप भी चेक करते हो. बट आई फील यस. So I always say that always examine your patient. Being a homeopath also, it is very important to examine your patient, because your remedy differentiation differs from that at some point. So yes, it is very important, and keep studying, keep learning, and yes, you will succeed.
Wonderful, wonderful. Very powerful experiences in sharing. I'm sure all of us are going to look at respiratory illness with a more positive aspect now, with a very positive attitude. Dr. Shraddha, any books for reference in particular that you have been using, you would like to recommend to doctors for treating respiratory illnesses with homeopathy?
Not particularly I use any book for respiratory complaints, but in general, generally in treating homeopathic cases or respiratory also, I have found Fatak's repertory very useful. It is on my desk always, because it is very handy and it gives you, if your case is not solving or at that time you are not able to think or give anything, it is very useful. Of course, Alan's keynotes and all our books are essential that you should have and study for at least respiratory complaints. For differentiating purpose, it is a very basic book. From that book you can start. Afterwards there are many actually. I would like to say there is book of our ML Dhavle College, Homeopathy in Pediatrics. So that small blue color ka book. So I would suggest that for pediatric cases, pediatric respiratory cases, read that chapter from, read the respiratory complaints from that book. It is very nicely written, and for pediatric cases it is very useful, respiratory complaints. So I would suggest, if people can get that book from anywhere who are not from that college, please get that book and read at least once. And otherwise, PJ Mehta, and I have used one 5-minute clinical consult. Actually, one of my professors had given me that book, so I don't know where it is available. But for your clinical practice, it is very useful. If you get anywhere online or anything, you can search for that.
Wow, quite interesting list of references. There's a lot more reading to do for all of us. Before we conclude, I just have two things to add. One thing is that when you mentioned using Fatak's repertory and Allen's keynotes, I'm sure there is a technique of using those books as well for references.
Yes, yes.
Uh, yeah. So I do wish to interview you once about how exactly one has to use different types of book, especially repertory being your subject. I'm sure we'll take that up in one of the future podcasts. The second thing is, well, as we are concluding this particular podcast, uh, Dr. Shraddha, would you like to share what topic you had taken up for your dissertation? Because this always remains, question of interest for me that when students take up topics for their dissertation, that completely changes the way they think, they act in their not just their educational work, but also eventually in their practice. So, if you could just share the topic or the title of your dissertation.
My topic was use of eliminating symptoms in forming the totality of cases. So that was the topic, eliminating. Actually, I wanted to take some interesting or something different, and where I can study the characteristic symptoms of the case or anything. So of course, our sir, Dr. Anup sir, helped me to select that topic, and eliminating symptoms in chronic cases was my topic of study.
Great, great. Wonderful. And sorry, just one last clarity I wanted to know is I'm sure it is given in the books, but still, from your point of view, what are low potencies, medium potencies, and high potencies? That I mean, like 30, 201 m in with that reference, what exactly do you use?
I actually use where I meant low potencies. I actually even use 6C to maximum 30. Medium, I have used 200 majorly, and above that, higher potencies.
Okay, fine. That was useful. Thank you, Dr. Shraddha. We conclude our podcast with Dr. Shraddha today, the Homeomitra Vartala. And we will meet again with new guests in the upcoming podcast. And thank you, dear audience, for listening to this patiently. Do listen to this maybe once or twice if you need to. And do share it with everyone because this podcast is having a lot of useful educational information and practically useful information. We are getting people who are into their day-to-day practice and they are actually working in that area of expertise. So yeah, thank you all and thank you, Dr. Shraddha, once again
Thank you.
for participating in Homeomitra Vartala.
Thank you so much, sir, for giving me this opportunity and platform to share my experiences. So, thank you so much.